just the fact that we can help them to that road to recovery and get their quality of life improved and be able to get ambulate. Like a lot of people, they want to go biking or hiking, they want to get outdoors, and they haven't been able to do that for a while because of the debilitating pain. So when an individual requires to have a new knee, hip, or shoulder, that's when I get to meet the patient. So I work as I would say it's a central hub for the total joint replacement team. So what that means is my primary role, it's communication, coordination, and collaboration. I manage and oversee while advocating for the patient before, during, and after surgery. We start off with, I'll meet the patient before surgery. We do like a one-on-one class. So I go over what type of surgery, recovery, make sure they have a support person at home, ensure that all their equipment, medical equipment has been obtained. We set up their home health, answer any questions. So that's part of our preparation. We also make sure they get to our PMC clinic that does like their blood work, testing like EKGs, chest x-ray, make sure everything, the patient's fully ready to have surgery. And then their day of surgery when they come, they're seen by, pre-op, gets them ready for surgery. The anesthesia department comes in, meets with them. They'll get blocks beforehand, and then, they follow the patient through to the OR. We have the OR staff, PACU staff. Once they leave recovery room, then they go up to the 6th floor. And with the 6th floor, we do have nurses that are trained to take care of the total joint patients. And then our goal is to get the patient out within 24 hours. So usually that same day of surgery, they're going to be seen by a physical therapist, an occupational therapist. And if everything proceeds as it should, they'll go home within that 24 hours with their home health. I round on everybody every day they're in the hospital. So when I do that rounding, we still go over the teaching we did prior to surgery, because you're just reinforcing that teaching about their DVT cuffs, their dressing. I'll let them know who their home health company is going to be, and then answer any questions that the caregiver or the patient may have. They're eager to follow the instructions, to prepare and, do what we teach them, because they want to get better, because they've just lived in pain for so long. I would say it's a huge role, because all these departments we have to come together to deliver the care to the patient in order to be successful, so that they are able to, one, get the surgery. We get them up, we get them ambulating, because this type of surgery, the patient has to participate, right? Like, it's not just you're going to have the surgery and then it'll be all better. You have to participate in your own recovery. And bringing all these departments together, it's one step closer to that patient achieving their goal.